Today, I would like to discuss the health belief model, which is a value expectancy theory that was developed in the United States in the 1950s and is integral to the understanding of medicine and illness today. I will also relate the health belief model to Patricia Lear's story theory and the current state of the advanced practice nurse. In this particular example, we will use the 6 components of the health belief model and relate them to nature, exercise, and most specifically, biking. The first component of the health belief model is perceived threat, which is an individual's belief that he or she is at risk of developing illness or the consequences of leaving an illness untreated. When deciding to embark on a wellness journey, in this case cycling, a perceived threat could include fear of inadequacy, physical injury, or the worry that not exercising could lead to issues down the road. The second component of the health belief model is perceived benefits. This is what a person believes will happen if they take action to treat said illness or disease. The perceived benefits of cycling or exercise are obvious to see. This includes spending more time in nature, cardiovascular health, and an opportunity to connect with others who have similar hobbies. The third component is perceived barriers. This could include cost, inconvenience, discomfort, and potentially danger. Barriers in cycling could relate to cost of equipment, access to safe trails or paths, concern for the elements, and stepping out of your perceived comfort zone. The fourth component is cues to action. The cue could be internal or external. Cues to action could include dissatisfaction with your physical or mental state, the desire to spend more time outdoors in a way that has a physical benefit, or simply wanting to get more involved with the cycling community. The fifth component is modifying variables. These are the social, psychological, or demographical factors that influence the decision to take action. Variables to exercise and cycling include adequate time to spend on the activity, how to balance work and family obligations while still making time to prioritize your health. The sixth and most recent component of the health belief model is self-efficacy, which is the belief that one can successfully perform a behavior. When it comes to exercise and wellness, self-efficacy is often an intrinsic motivator that needs to be fostered by a realistic sense of self and a willingness to put yourself in sometimes uncomfortable situations with the knowledge that the health outcome will be favorable long-term. Let's talk briefly about the theorist Patricia Lear and the middle range story theory. Lear's theory is characterized by the mantra, connecting with self in relation through intentional dialogue to create ease. This theory is based on the assumption that the human story is vital in the context of healthcare, and it is up to the nurse or provider to facilitate storytelling and then provide full attention. Listening to a patient's story provides valuable insight into the unique perspectives and thought processes. How does the story theory relate to the health belief model? Unless there is a facilitation of storytelling, the nurse or provider would be unable to understand a patient's motivating factors. Providing a listening ear in a non-judgmental environment will allow the patient to express their story with their own viewpoints mixed in. Both the health belief model and the story theory are important as we strive to become advanced practice nurses. I believe that learning about the patient's story, whether that be the current situation or past events, is just as important as prescribing the right medication for high blood pressure. Understanding the patient and their story is integral in providing healthcare with favorable outcomes. We need to understand the whole patient picture and address all aspects of the health belief model, which can be accomplished through the facilitation of storytelling. The benefit of therapeutic communication is limitless in that it serves the advanced practice nurse and allows the patient a safe space to tell their story. When you are embarking on a wellness journey, whether that be hiking, biking, or simply just spending more time outside, we need to think about the factors that motivate us. Nursing theories provide a platform that is applicable both in practice and in our personal endeavors for